Hello, everyone, and welcome back to another episode of Mama Bear. I'm Bree.
And I'm Erin.
And today we are talking about midwifery care in Ontario. So we know that there's different options for your care as a pregnant woman. Mm-hmm. Here in Ontario, you can choose to be with an OB, your family physician, or a midwife. Erin and I both have different experiences with this. Her pregnancy, she's separately gone with an OB and a midwife. Mm-hmm. I went with a midwife, and Erin actually works in an OB clinic as well. So we have some varying experiences on this, but today we thought it'd be awesome to bring on an actual midwife who delivered my first son and my sister-in-law, Kailey Esser. Welcome to the podcast.
Stay with wisdom and warmth, let's light the way. Together we'll laugh, together we'll share in this cozy space. It's love and care.
Thank you for having me.
Yeah, we are so excited to chat today with you about the different options, like I said, but specifically that midwife piece. But first, we want to get to know you a little bit more. So can you tell us a little bit about why you became a midwife?
Honestly, it wasn't any kind of big revelation. Somebody came to my school to talk about different careers, and I thought it looked like something that was a really viable option. It, was one of the few career paths where you go to school and you get a degree in that thing, and that's the thing you do. And there are many jobs out there, and I took the opportunity to go to a home birth of a family member to see if it was for me.
Oh, cool.
When I was thinking about it, and thought, yeah, this would be a good path. So I did a little bit of doula work and a little bit of self-study, and then I applied and went to school and became a midwife.
Can you tell us how long that education actually is to become a midwife?
It's 4.5 years.
4.5 years.
And where did you study?
I studied at Laurentian University in Sudbury.
Amazing. Mm-hmm. And so now you're working as, is it registered midwife?
Yes. You have to write an exam. Do you have to write an exam?
There's a licensing exam.
There is a licensing exam. Okay. Yes. Okay.
Amazing. So I guess what's the draw or appeal out there of selecting a midwife as your practitioner or your birth?
We are, as you mentioned, one of the options, and obviously as a midwife, I'm biased, but I think that we provide a pretty good care and useful care. One of the main draws of midwifery care is that we offer a little bit more rounded postpartum care. So when you see an OB or a family physician, you're typically, if you're an OB patient, after your baby's delivered, you're not seen again for 6 weeks. Mm-hmm. Whereas with a midwife, you're seen 3-4 times that first week.
Right.
And, you're seen likely 5 to 7 times in the first 6 weeks. Mm-hmm. So just a little bit more care and attention is paid to every person postpartum, not just high
And
risk.
are you seeing do you do any care on the baby as well after postpartum? Do you do any checkups with the baby itself?
Yes, absolutely. So we are trained in both maternal postpartum care and in neonatal care. So we're able to do all of the appointments as kind of a dyad. And so you don't have to take yourself and your baby to two different places.
Because I know working in obstetrics, that when you go to your postpartum appointment, it is just for the mother. It is not.
Oh my gosh.
It is not for the baby. So the baby's appointments are separate to either the baby's pediatrician or your family GP. But with the midwife, it is all kind of done as one. So that saves you a trip.
Exactly. And speaking of saving trips, we actually offer the first week of visits at your home.
Wonderful,
so you don't have to
regardless
leave at
if
all.
it's home birth?
Yeah, regardless.
Yeah, I actually, so with a midwife, there's an option, right? You can have, people a lot of the time assume that if you have a midwife, you're doing a home birth.
Yeah.
You can have a midwife and do a hospital birth
Absolutely.
as well. I did that myself. And yes, then my midwife came to my house, actually, now that you mentioned that, afterwards for postpartum care, which is huge. Huge.
So you're doing a hospital birth. You bring your midwife along. Surely there would be an OB in the room, would there not? No, not at all.
Nope.
So a midwife can be your number one attendant in the room, or
so your midwife ideally should take the place of the nurse and the OB.
Wow.
Both following you through your entire labor, doing your cervical exams, monitoring your baby, monitoring your progress, monitoring your vitals, and then with an OB, the nurse would be doing that, and then when it came time to deliver, or if there was an emergency or large concern, they would call OB to assist or deliver the baby, whereas the midwife does the whole piece. So you're not calling someone else in or waiting for anyone else.
Okay.
We do call a second midwife for an extra pair of hands just because 2 patients, we need 2 providers. But but no nurses or OBs. But obviously, one of the benefits of a hospital is that those people are available.
They're there.
Should, you have an emergency or a concern.
I don't think I realized that the hospital birth is essentially home birth, just in the hospital.
Yeah.
Like it's still just midwife and midwife assistant in the hospital setting. Interesting.
So so I had because I did, like I said, I had OB care for my second, but I had midwifery care for my first, and that was something I didn't realize either, was that I wouldn't. So when I had my second, I had a nurse that kind of helped me through the laboring process, and I didn't see an OB until it was time for delivery. And with the midwife, I didn't have a nurse. It was just my midwife that stood with me the whole time during my laboring process, and then also through delivery.
Amazing. Okay, so let's rewind a little bit here and go back to you're newly pregnant. You just found out you're pregnant.
Yes.
You've decided.
Congratulations, by the way.
Oh, sorry, I didn't mean her. I'm walking through like the process of like someone just found out
I
they're
thought you were
pregnant.
talking to Kaylee.
Kaylee's also pregnant, so that's a very exciting part of this episode. But you just found out you're pregnant. You're deciding, okay, I want to have a midwife through this pregnancy. They come into your care. What does that pregnancy care look like over the course of a pregnancy?
Well, we operate in similar ways to OBs and family physicians, as in we offer all the same prenatal tests, screens, medications, and ultrasounds for the most part. And we see people on about the same schedule. One of the things that is a little bit different is we tend to have slightly longer appointments. Midwives do tend to have like less patients than an obstetrician would have, which allows us to spend a little bit more time in each appointment. And one of our pillars of care is informed choice. So really going over every upcoming screen, test, ultrasound, and making sure that, questions are asked and answered and that people have a good understanding and are making the best decision for them and their baby and their body.
Amazing. So
What gestation do you start to see them at? At what?
Typically, our first appointments, we try and get in at 10 weeks.
10 weeks. Okay, so that would be different as well from obstetric care, right? Because you're seeing them a bit earlier in their pregnancy, which I know some women, when they get pregnant, they kind of want to get in there and see someone right away, right? And with obstetric care, you don't see them till much later, unless you're a bit of a higher risk pregnancy. But in a typical pregnancy, you see them much later, and you're kind of like anxious to get in there. So with a midwife, you're able to kind of start that right away.
Earlier.
Yes.
Yeah, that's a huge draw.
Yeah.
Okay, so you cover the same type of things. How would you, if someone wasn't sure where they wanted to give birth, or they aren't even considering a home birth, how does that come? I guess I'm really interested in the home birth piece of it. So I guess how do you tell them, hey, you've got options. You can birth at home in the hospital, or do you let them bring that to you? Like, how does that work?
In the initial appointment, when they come to see us at around 10 weeks, I just bring up that one of our pillars of care is choice of birthplace, and that we're the only healthcare practitioners that will deliver your baby wherever you feel comfortable in Ontario. I tell them that for a lot of our clients that's the hospital in town, that we have privileges, and that we have good relationships there with the OBs, the nurses, and the anesthesiologists for our clients who choose to have epidurals. However, if you're a low-risk pregnancy and you're an appropriate candidate, which luckily most of our patients are in midwifery care, then we do carry a level 1 hospital worth of equipment in our cars, and we do offer to deliver your baby at home if that's where you would feel more comfortable. Some people have fears around hospitals, or just like the idea of being at home.
Right.
To be honest, in my community, it's not a high percentage. It's probably
of home births?
I was going to ask that.
No.
Are you seeing that more lately, the home births, or not so much?
I wouldn't say
like in
I
your
am.
personal experience,
like in my personal experience, not based on any research or anything, but I usually quote it at approximately 10 to 15%.
Interesting.
Okay.
For our
Surprises
clinic.
me. Yeah, I mean, that doesn't stand for all of Ontario.
Yeah,
That's
no,
Kailey's
certainly
personal
not.
experience.
There are communities in Ontario I know that are 50% home births.
Right.
Wow,
Okay.
amazing.
Just your personal practice, you see a lot of hospital.
It's certainly
births,
more
okay.
hospital, but we get a couple of home births a month.
And can I ask, do you prefer one over the other?
Oh yeah, good question.
I mean, it depends.
You don't have to answer that.
No.
There are clients that I certainly want to be in the hospital because of risk factors or, other things going on, where if you're not a good candidate for a home birth, then I'm not super comfortable at home.
Of course, yes.
But home births are really beautiful if you're an appropriate candidate for it. There's something about not all the beeps and bloops of the hospital
Yeah.
and all the pages and all the
Totally.
things.
I can
that
imagine
go
it's a
on,
great
yeah.
experience for you when you do get to experience those home births. Yeah.
Yeah, and I have experienced many beautiful home
Yes.
births.
That was actually one of the big reasons for me wanting to do a home birth was like I get like very nervous around a lot of people, like just in terms of like if I have a hard thing to do, I want to be alone and put my head down. And so the idea of being surrounded by a lot of people in and out of the room or people suggesting, different, it just seemed overwhelming to me. So the option to stay home and just have it be like that intimate, private thing was a huge draw for me personally. But branching off now, a huge flaw, at least in this area of Ontario, we don't have any birth centers. Do you have any experience with that?
I do actually. I worked in Ottawa for a year as a midwife, and we had the beautiful Ottawa Birth Center there, which a lot of our clients did choose to deliver in, and it was a really lovely.
Can you expand
facility.
on that a little bit? Like what? So
What does that look like?
Yeah.
Like what is the difference between that and just delivering at a
home or a
home
hospital?
or a hospital?
So
Kind of like the middle ground, right?
It is kind of the middle ground. Of course, there's nobody there except for you and your midwife and, whoever you're bringing with you, and the midwifery assistant, who's usually another midwife. It was a beautiful facility, like big, comfortable beds, massive pool-like tubs. So that was kind of a lot of the draw. A lot of people kind of liked the idea of like not having to invite people into their own space or not feeling like they need to clean up before or after.
So it's essentially like a staged home birth.
Yeah.
Like it looks like a home. It looks like a room, like a bedroom.
Is there anything
It looks like a
there
bedroom.
that is beneficial in terms of
Like
it would
medical?
be close medically? Yeah.
So they had kind of a bay for ambulances, which obviously you wouldn't have at your house. And they even, I remember when they were opening, ran drills with the ambulances to get the timings of how long it would take and practice like loading people in. And then they have obviously a more permanent setup for like neonatal resuscitations and emergencies like that. Obviously, when we do a home birth, we come with our equipment and set it up, but it's already set up at
So
the
that
birth
is an
center.
incredibly wit's middle ground, right?
yeah.
Like
It's
that is
such a
something
missed opportunity in this
I was going to say
area.
that is something that we don't have the option
No,
for,
not here.
Yeah,
which would be amazing.
Some midwifery clinics even have birth suites like in their clinic space, but we unfortunately don't
So
have that
this
either.
space, I'm sorry to go back, the birthing center, it's several rooms, like how many?
The Ottawa one was 3.
3
Oh,
rooms.
cool.
Okay.
3.
Yeah, because I
Living
imagine
rooms.
more people would like the idea of doing like the home birth idea if there was a birth center, knowing that you still get the comforts of home. That people are leaning towards it, but still scared and they want the medical like safety and security. Like I feel like that's such a better option in my opinion. I know something that scares me about the hospital is just like I always talk about the cascade of interventions. Like you're right there. They want to give you that Pitocin, they want to give you that epidural, but being like just separated from that enough that it's kind of a little bit out of reach. But because can they administer that? And no. So still
No
not
Pitocin, no epidural in the birth center.
but you are in a little bit more of a, I guess, medically centered space.
Yeah, there's
built for home birthing essentially.
Yeah, exactly.
Cool.
that is very cool.
Okay, so then branching from that, leading up to the days of delivery, women, as we can attest to, get nervous. There's some certain fears surrounding delivery. How do you touch on that mental piece or emotional piece of like fears for delivery, or how do you approach that in your care?
definitely we have at 36 weeks pregnancy, we have what we call a prep for birth appointment at our clinic, where we spend an hour with women talking about the birth plan, what to expect, pain management options, when to call us, what's normal, what's not, strategies for when you're at home in the early labor piece. Because there is, even if you are planning a hospital birth, even if you have an obstetrician, there is a period where you're likely in early labor for a while at home, which some people I think don't realize. So we do go over kind of as much preparation as we can with women, but I definitely do at the beginning of pregnancy recommend that women do their own preparation as well. I find that if you're prepared, people tend to do a little bit better than people who are kind of coming in very blind.
You mean prepared for like what labor looks like, or
what options are, what's going to happen, how things go.
Yeah.
You know, whether that's a prenatal class, online, in person.
You mean just like understanding the flow of like what a labor would look like?
Do you have any tips for like early labor like pain management?
Speaking as a woman who hopes to give birth again.
So there's definitely different kind of methods you can go. One really good tool that I sometimes recommend is a TENS machine. I don't know if you've ever used that.
No.
But a TENS machine, it's often used in like sports medicine,
Yeah, I was just gonna say we use it with basketball.
You can get them online or, in some stores. And some people really find they're very useful in early labor.
Yeah.
Can you explain kind of what that is and what that does?
Yeah, so it's like sends like a little electric pulse,
like a muscle
into
contraction
into your muscle.
Okay.
And so you stick the little electrodes on your back or your legs or wherever you're feeling a lot of pain and tension. And typically there's options on the TENS machines, or at least the ones we used to use, where you can like boost it during a contraction, and it just kind of like breaks the pain. The
brain waves,
brain waves and connections, and helps to ease early labor. It doesn't do too much in active, but it can really help women get through early labor.
Interesting.
Hydrotherapy too is huge.
like getting in a tub.
Getting in a tub, getting in a shower. So many women who, feel that they want to deliver without a pharmacological pain relief feel like they could not have done it without hydrotherapy.
I did a lot of early labor when I had my midwife for my first daughter in my tub.
Yeah.
And my husband's like, you were like a whale in there. You're just making all these noises. your big stomach's just like he's like, it was quite the experience.
You can see, like, even in active labor, like women when they get in the tub, like the dramatic shift.
Yeah.
It's really
feeling way better immediately. So when women are really having a hard time, I'm like, the first thing we need to be doing, if it's not an epidural that they want, is to try and get them in water in some method.
We talked, sorry to cut you off, but we talked about this the other day of, like, for me, I just forgot. Like, when I went into that transition, it was like the hardest part of labor for me. That didn't even cross my mind. Like, I was just like, take me to the hospital. I'm done. I can't do this. And instead, we should have been doing something like this, like getting in we didn't have the tub set up, but like getting in the bathtub, just drawing a normal bathtub, or just getting in the shower. Because when I did get in the tub later in labor, it, like you said, it is a dramatic shift. My pain cut incredibly. I can't believe we didn't use it.
Going off of that, do you typically, because you as a midwife, you don't actually come to the labor during those early labor hours, do you?
Typically not.
No.
I mean, occasionally we'll assess somebody, but if you're not in an active labor pattern yet, if your cervix isn't at least 4 to 6 centimeters dilated, if you're not contracting regularly and strongly, that could go on for days.
So sometimes will you go check a patient, see where they are in their labor, and then
say it's not quite time yet.
Yeah.
Oh, that must be so hard to break the
news.
Yeah.
Not easy.
Nobody wants to hear that they're only 1-2 centimeters dilated when they've already feel like they're working very hard.
And do you work sometimes hand in hand with a doula? Or do you
This is actually one of my
typically
questions
work
too.
on your own?
Well, doulas, they're not like regulated healthcare professionals.
Right.
So, I mean, they're great tools, and but they kind of do their own thing.
Right.
Like, obviously, I've been at many deliveries where doulas are there, and I love it when they're there.
But that's
they do a lot of
separately then
help. Yeah, but it's not like we collaborate or we have our doulas that we work with. It's just whatever doula people.
Because a doula is essentially
Hire.
a support person.
Yeah, just like a hired support person, essentially.
Right. So that is someone that could be there through early labor.
Yeah.
If
Technically,
they're
your
someone
doula should be called before your midwife in most circumstances.
Okay.
Yeah, big regret on my part.
Good to know.
Called my doula too late.
Okay, good to know.
Cool. Okay, so we just went through some home birth stuff. Okay, so now you're there for the delivery. You've showed up. They've called you. Delivery's progressed, hopefully much more than 1 to 2 centimeters. You're coming past that 4 to 6 centimeter phase. Can you break down the support you provide in that, like, leading up before pushing?
Yeah. So, as I mentioned before, we're kind of like the nurse that you would have in an OB or a physician delivery, as well as the kind of like physician role. We're kind of our own thing, which means that, not only are we monitoring your baby's heart rate and your vitals and, your cervical dilation and your progress in labor, we're also helping you through labor, especially if you're trying to do it without pharmacological pain relief. So some like hands-on massage. Obviously, some people like it, some people don't. So we really kind of follow your cues, counter pressure, hip squeezes, those kinds of things, and a lot of verbal coaching to help people to find the right breath and, relax their tension and help the baby to pass through. And
are you suggesting
reassurance.
positions and and things like that.
Definitely, yeah.
And you're able to monitor, sorry to go back to home births, but you're able to monitor the heart rate and everything of the baby, even at home. You have that equipment if they choose to do a home birth.
We do.
Okay.
There's kind of two different ways babies are monitored during labor. One is intermittent auscultation, which is when you're listening with a handheld device every 15 to 30 minutes. And the other is external fetal monitoring, where you're hooked up to a machine, which basically traces the baby's heart rate, where you can see it visually and hear it 100% of the time. Anybody with risk factors should be, doing the external fetal monitoring. So people who've had a history of C-section, or people who have multiples, or known very small babies, those kinds of things. And that can only be done in the hospital. So we're only taking low risk people at home who are appropriate for just listening every 15 to 30 minutes with a handheld device.
Okay.
Something I hear often and happened in my own case is when you're in that delivery mode. So you're pushing, baby's coming, or the pushing section or later labor is dragging on, and the baby's been in that like birthing canal for some time. There are some risks that the baby's heart rate can drop or be under distress. Can you just expand on that? I know this is my personal question, just because when I go to explain it to people, I'm confused too. Like, so you're assessing the baby's heart rate, and it picks up during a contraction,
It
or
drops during a contraction.
and then so you're watching like how long before it comes back up, or like what's the fear there, and then how do you work through that in a home birth, I guess.
Yeah.
And does that vary from like a hospital birth, or like how you would approach it?
So babies, they can't really communicate with us during labor. The only way that they can is through their heart rate. So labor, as the both of you guys know, seeing as you've both gone through it, it's a really difficult thing to go through. And it's actually, people often forget that it's difficult for the babies too. They are, getting big squeezes, and they do react sometimes in a negative way to labor. Now, most babies, just like most women, are built to withstand it and have the stores that they need, and if everything's going well, can get through it. But in certain circumstances, so let's say a placenta that is not super well attached, or a baby that is super small and maybe doesn't have all the great blood flow through the cord, or maybe they're positioned in such a way where their cord is kind of compressed during certain contractions. It kind of pushes against the cord, essentially cutting off their oxygen supply. We would start to see them get like kind of grumpy or unhappy, where their heart rate starts to show signs that they're kind of slowly deoxygenating during the delivery. That whether it's the placenta, or whether it's the blood flow through the cord, or compression, or whatever is going on, they're no longer getting what they need to do well. And so I often kind of relate it to, if you had to go underwater for a minute every 3 minutes, you could do that for a while, right? But you probably couldn't do that for 3 hours.
Right.
You would eventually start
Tire out.
to turn blue and feel worse and feel worse and feel worse. So, and that's one of the reasons why we care so much about progress in labor. I know that it gets a lot of hate to be like put on a timer, but definitely, if you are in labor for days on end, real active labor where you're like squeezing that baby really hard every couple of minutes, eventually you will stop doing well, and so will the baby.
Right.
So we need to be checking that their heart rate is not showing those signs. So it can be normal for the heart rate to go down during a contraction, as I said, during that squeeze. But one of the things we're looking for is we want a quick recovery after. If it starts to take them longer and longer after every squeeze to get back up to where they need to be, then we start to know that they're starting to do worse and worse with the labor, and that they might not be tolerating. And if we're in the pushing stage, that might mean it's time to move to something like an assisted delivery, so forceps or vacuum. Or if we're still in the early stages and we have hours to go, that's when people often end up with cesarean sections.
Oh,
and are you able to implement those like forceps and vacuum, like as a midwife? Are you guys able to?
No, we consult the obstetrician, because at that point it's considered.
So if it was a
high
home
risk,
birth, at that point it'd be moving to a hospital.
So we would obviously have a fairly low threshold at home. If there's concerns, we would recommend being at the hospital. And sometimes we go to the hospital and the heart rate resolves, the baby gets out of their funny position, gets better blood flow, and starts to feel better. But you definitely don't want to be in a situation where the baby is, slowly over time getting worse and worse and worse and worse, and we haven't made those moves to be in a place where we can help the baby out by
so at that point,
additional means.
Are you working collaboratively with the obstetrician? Like,
Typically,
you're
if
still
we
kind
need
of
to
working
move to an
together?
operative delivery, we move into a supportive role.
Okay.
So our role is to, support the mom, but her new most responsible provider for her care is the obstetrician on call. The midwife, the baby is still our patient. So we're there to receive the baby and be part of the neonatal team, helping the baby transition to life, weigh the baby, examine the baby, gives them their medication, all that stuff. Obviously, if there are big concerns, we get a pediatrician involved. But if the baby is well on delivery, then we are still taking care of them, even if the mother did have a C-section or something like that.
Okay, good to know.
Okay, so we've delivered the baby. Baby's here now. Whether you're at home or in the hospital, this is something it was hard for me to picture, although we walked through what this would look like post-delivery. It's hard to picture this, like what your first moments and hours are like with the baby. Are you able to break it down, like from your perspective, like what you're doing to support the baby and mom, what the assistant's doing, what that looks like in a general sense? I know it's always different, but break down the initial first few hours, and then we can expand onto those first few days and
how long you're typically with the mother and baby and family and after birth?
Yeah.
In my experience, I delivered at 2:20, and I think my team was there until about 6 a.m.-ish. Is that pretty standard?
Yeah, I mean, it depends on how everything's going, of course. We typically are staying for about 2 to 4 hours. Okay. So once the baby's delivered, we put them directly on your chest, and if the baby is, well, then
that must be the best moment ever.
Then they should really stay there for the next hour or so. And obviously, we will take them if they need any additional support. But otherwise, we kind of leave them be with you. We do our vitals kind of around them being skin to skin with you, and we delay the initial weight and exam until after the first hour for most circumstances, unless people are really dying to know the weight. So in the first hour, mom has vitals every 15 minutes, and
that just means checking her heart rate,
checking your blood pressure, and checking your fundus, which is a pretty uncomfortable squeeze on your uterus to make sure that it is firm and not filling with blood.
Can you explain some of the benefits of the skin to skin for the first hour?
Oh yeah, it's great for bonding. It's great for temperature regulation. It's a nice transition to life for a baby. They were inside you for 9-10 months, and now you don't want to rip them away too quickly. And that's so nice to not have someone be ripping your baby away from you, because you just worked so hard to
of course get that baby out. Now you want to keep it.
You want to keep it for sure, and it's good for mom's recovery too. Oxytocin, keeping her blood loss minimal.
And that helps the placenta as well. Yeah,
it helps the placenta deliver on time.
Correct me if I'm wrong, it encourages in breastfeeding as well to have the baby on you for
the
first
absolutely
hour, correct?
They'll often, you put the baby on, and within minutes you can see them start to bop their head, rooting around, looking for the breast and nipple. That first hour is kind of, we're kind of working around you, making sure that your placenta is delivering well, checking for any tears in the vagina or perineum that needs to be stitched, and performing those repairs if they need to happen. So the first hour tends to be, you're just kind of with your baby, and there's lots of stuff happening. We're checking the baby's vitals every 15 to 30 minutes. And then the next hour is kind of a little bit more relaxed. Often we'll kind of step out and give you a bit of space and kind of catch up on our charting, because vitals can move to every 30 minutes at that point. But of course, we're right there if you need us or if you're having any concerns. And then after 2 hours, you're actually considered recovered.
Wild.
So
I did not feel recovered.
No. I mean, obviously some people, if there are concerns with, if you had a C-section, you won't be recovered in 2 hours. Right. If you had a hemorrhage, you won't be. But for a low risk delivery. So if you're at home, the midwife could potentially start packing up to leave at around 2 hours.
It's crazy.
If you're at the hospital, you will often be moved to a postpartum room where you'll stay, for the next, usually people stay for 24 hours. And again, you won't kind of have that one-to-one care, but you will be able to kind of push a button, call a postpartum nurse in, and they'll do your vitals usually every 3 to 4 hours and call us.
That is another benefit of midwifery care, though, right? If you are having a hospital birth, you're able to leave the hospital sooner, because I know if you have an obstetric birth, you are asked to stay 24 hours because they do a 24-hour neonatal check on the baby. Yes. But with a midwife, they could do that at home.
Exactly.
So you're able to leave the hospital sooner.
Exactly. Yeah. So some people leave, directly out of the delivery room and never go to a postpartum room. Again, at around 2 to 4 hours feel well recovered, and instead of going to postpartum, they go home, and then we come to see them for their 24-hour check.
Wow.
Well, I mean, if that's at 2 a.m., 24 to 36 usually. Up to 48 is appropriate, but usually between 24 and 36.
Okay, so then break that down now, kind of like we did for pregnancy. Now, how do those check-ins, appointments, you said both the infant and mother are still your patients. So now can we talk through that, like postpartum care?
Yeah. So if you decided to stay at the hospital for the first 24 hours, or you needed to because of a C-section or other complication, we'll come and visit you in the hospital, help you with breastfeeding, make sure everything's going well, and sign off on your discharge. If you had a home birth or went home early, then we'll come and see you for that initial appointment, do all of baby's routine 24-hour screens, and check vitals again, make sure everything's well. Then we typically come back on day 3, regardless of, where you delivered. That tends to be everybody's kind of lowest point. It's where babies...
Yeah, that's interesting. I remember you saying that.
Lose weight. Babies are typically their lowest weight on day 3. They typically have the most jaundice on day 3. It's when your milk is coming in, so your baby's been hungry. They've typically been up the whole night before. Lots of hormones come in with the milk. So day 3 tends to be the hardest day. So we come in and check and make sure that that low point's not too low, that everybody's still doing okay. We come back on day 5 typically, and we hope to see that those scales have changed a little bit, that hopefully the weight's going in, weight's going up, milk is in, feeding's well established, jaundice is down, everybody's feeling a little bit more settled. If that's the case, then we start to see you back in clinic, usually 2 weeks, 4 weeks, and 6 weeks. And those are, of course, just our baseline appointments. So if, on day 5, your baby is not gaining weight, then we'll typically come back on day 7. Or if your baby needs daily jaundice checks in the first week, which some babies do, then, we're often able to offer that at home as well.
Amazing.
Yeah, that ability to stay in your home that first week is really, really beneficial.
So nice.
Because leaving your house with a baby, especially your first baby, is very daunting. And especially if you're driving yourself. I know if you had a C-section, you're not able to, but if you had a vaginal birth and you're driving yourself and your baby to this appointment, and I know for the first little while for myself, my husband drove us around and I drove in the back seat with my baby just because I was very anxious about my baby being back there by themselves. Yeah. So having you be able to come to the house is great.
It is a huge, just a huge draw of the home birth is exactly this. You gave birth, you and your child have not left the house yet. You're right there. Everything's where you want it. When you take that shower, it's all your own things, your own clothes there. Your husband can grab you a snack from the pantry, just these different things. It's very comfortable. So I big advocate in that sense. So now branching, same idea, but we touched on the pregnancy support and that mental piece. Can you touch on the postpartum mental health care and how, if you have any experience with that or things that you've seen to help women in those early days?
Supporting, if you see any postpartum depression, anything like that.
Yeah, so postpartum depression and postpartum anxiety are we're not mental health care specialists. Yeah. So if we're concerned that somebody's actually coming down with a postpartum mood disorder, we definitely would refer to those specialties. Unfortunately, it is hard to get in with those specialties in Ontario. Mental health care is pretty limited, so it can be hard to get people those resources. But I do find that people tend to do much better when they're not isolated. I know that COVID was a really hard time to have a baby for those reasons, because a lot of those supports that are available now were not available. But, we have early on group that a lot of our clients really advocate for and say, how much it helps them to, go spend time with other moms.
Oh, I've heard of this early on.
Oh my gosh, it is. Being with other moms is so healing.
I need to look into this. People keep telling me about early on.
To be able to talk to another mom and be this, I'm suffering with this. And for them to be I suffered with that too, or I'm suffering with that too, is so validating.
Yeah, it would be really nice, because sometimes we would hear from our clients that they would know other clients through early on and would kind of bond with them, which was really nice to kind of see that. So definitely getting out of the house and, trying to, spend more time with other people and who have had similar experiences. But just overall spending some time for you, which can be really hard, is what I always recommend. And then also just recognizing when you're not doing well. There are people who need medication for postpartum mood disorders. It's a real thing. it can make your first year with a baby really, really difficult. And there are medications that make it better. So, you know, if you're finding every single day is a struggle postpartum, you know, past kind of the 4 to 6 week mark, then I am usually encouraging people to see their family doctor to consider a medication option.
Wow. Okay, so now just shifting gears a little bit, we kind of touched on the fact that you yourself are expecting. So congratulations.
Yeah,
It's
thank
so
you.
fun. Before we get into your pregnancy, how does your pregnancy affect being a midwife now?
Like now that you're on the other side of things, has your perspective changed on any of the care you provide?
I wouldn't say like dramatically. I mean, it's nice in a lot of ways to experience, you know, some of the things that before you only know the theory, like round ligament pain and you know, stuff like that, kind of knowing what that's like. But overall, I'd say not a dramatic shift.
But do you think you'll be able to provide more like empathetic care now that you, like you said, have experienced these things for yourself? You kind of can have different, you know, ways of explaining them or explaining relief to patients?
To be honest, like, who knows with after the birth itself, but I kind of am resistant to that kind of way of thinking, just because I find that obstetricians aren't held to that same standard. A lot of obstetricians are men. And
that's true.
They never kind of, you know, some midwives do kind of struggle who either are child-free by choice or child-free because of infertility or other things where, you know, some patients are like, oh, I don't want a midwife that has never delivered. But obstetricians aren't held to that standard. And I mean, like, you don't expect your heart surgeon to have gone through heart surgery.
Right.
That's fair. It's a great way of looking at it.
So, I mean, I like to think that I still provided good empathetic care before I was pregnant. And I almost hope that it doesn't change too much because you know, a lot of the greatest midwives I know are child-free.
Yeah,
that's a great way to look at it.
That's a really good way to look at it. So now shifting, are you comfortable if we talk about some of your like pregnancy? Like, have you felt any early on symptoms? Like, do you have morning sickness? How are you feeling now that you're at just over the midway point?
Yeah, well, I definitely had a couple of rough first weeks, which I think a lot of people do in their pregnancy, but then things kind of smoothed out, and second trimester, I'm feeling pretty good right now.
Feeling good, getting some of that energy back?
Yeah, absolutely.
Yeah, have you found it more difficult in your pregnancy to go to like night births and stuff like
Definitely.
that?
Yeah.
Because you have a little bit more fatigue, right?
For sure, and definitely like before I was pregnant, I could run out of the house on an empty stomach without drinking water and like quickly run to a delivery, which now I have to kind of pause and make sure I have some snacks ready. Yeah, because my body is a little bit more sensitive to those kinds of things for sure.
And the recovery, I'm sure, is not as quick either. In the mornings after a long birth.
A little more sleep
Definitely,
time.
for sure.
Amazing. So now, what are your hopes for your delivery, if we can touch on that? So, like, you've seen all different versions of birth. Is there tactics you're taking for like your early labor? And obviously this could all go out the window, but like, are there hopes? Do you hope to have the twinkling lights? Do you hope to have the sound machine on, like a full room? Like how do you picture your birth experience?
Yeah, I mean, I'm hopeful for a home birth. I mean, I also, like, as you said, I've been to lots of experiences, so I know how that can change and be out of your control. So I'm trying not to be too married to the idea, with the knowledge that, you know, a lot of things can happen and you just kind of have to roll with it. But if all things go well, then I'm hoping to have a home birth without, you know, really pharmacological pain relief, using the hydrotherapy like we talked about, and keeping things hopefully natural. I'd love for things to go fast and uncomplicated.
We hope that for you too.
Yes.
Yeah, amazing. So I guess we hope to have you back like after the baby comes and talk about, you know, how the delivery went and kind of like last episode I shared some of my experience with my birth story, and we'd love to like follow you through to this other side of parenthood and how the early days go and chat through all that with you. Do you have any other questions?
Well, before she goes, I have one. Sometimes Brie and I play a fun would you rather game on the podcast.
Okay.
I have one fun. It's just a silly would you rather question for you.
I also don't know what she's about to ask.
It's pregnancy related. You're welcome to answer as well. So would you rather crave pickles and ice cream every day or sardines and hot sauce?
pickles and ice cream or sardines
and that's together.
I hate pickles and I hate sardines, so that's a hard one.
Great question.
I definitely never had any of those pickles cravings. I'm not a pickle person, but
Like not even, you don't love pickles.
I do not love
I think we
pickles.
I
just
feel like
butt
pickles
heads.
is such a common
love
craving in
pickles.
pregnancy, and I don't know if it's the
No.
crunch or what it is.
I
but
never had the craving, but I just love a good pickle.
I love a good
No,
pickle too.
I've never been a pickle person, but I think I would probably choose that over sardines.
So
Because I like ice
pickles
cream.
and ice cream. Yeah, it'll hopefully mask the
Wait,
flavor.
what's
Yeah,
the sardines
exactly.
and what?
Sardines and hot sauce.
Or pickles and ice cream? Well, for me, I love pickles. So pickles.
See, I would pick sardines and hot sauce because I think hot sauce can make anything taste good.
It's true, but don't you like you had to put the ice
Them
cream on the
together,
pickle.
yeah.
You know what? I hate to say it, I don't think it would be that bad.
Maybe we should. You know what? New segment.
Actually, either.
Trying pregnancy cravings.
We actually should. I don't think either sounds bad. Like the pickles and ice cream sounds weird, but actually,
But
in a weird way, I might like it.
Vanilla bean ice cream and some pickles.
Wait,
it
do
might
people
work.
do that?
It might work.
I bet
actually
you
real-
people do.
Is that a real craving?
Probably. Most likely. I mean, people crave weird things.
Yeah.
Speaking of, have you had any weird cravings?
I wouldn't say anything super weird.
Nothing
I've
super
been
weird.
eating like a lot of cheese, but
Oh,
that's
okay.
true pre-pregnancy
Okay.
as well. But so I don't know if
Do you
that's
know what?
pregnancy
I
related.
ate when I was pregnant with my second daughter. I could not stop eating Tim Hortons biscuit breakfast sandwiches, and I am not a breakfast sandwich person
Yeah.
at all. Like to this
Interesting.
day, I rarely eat breakfast.
don't
I know
have-
that's bad, but
Yeah, shame.
but I could not stop eating Tim Hortons biscuit breakfast sandwiches.
So strange. I guess you're saying you don't have any weird ones because you're also like privy to like all the things you've heard. You know, you have a lot of clients you've heard.
Yeah,
So I'm
true.
sure to you, most of them sounds normal. Like to me, I'd be like, my weirdest one was I just like watermelon. But you're like, that's a pretty
That's very
standard.
normal. Yeah,
It's a normal.
that's
So
a good one.
I think that's like so many people crave that. 'cause it's so- and
Hydrating.
you're so
Thirsty.
thirsty
Yeah.
during pregnancy. Yeah.
Yeah. I thought you had one more. Did you have a second one?
Oh, well, okay, one more. Would you rather be nauseous for all 9 months of pregnancy or be in active labor for 72 hours?
That's a mean question. Those are both terrible. I guess nausea. I guess.
Yeah, I think I would be the same because
I mean, you can't.
yeah, it's like a duller
Active labor.
longer.
I mean, no, you can't do that.
Like, it wouldn't happen, but
Yeah.
if it could.
Yeah, no, I think I'm with you on that one.
Yeah.
I guess because the nausea is like a duller, and I guess like it sucks, but you're gonna see the other side of it
Yeah.
eventually. Whereas the active labor piece,
And
like,
there are women that do experience that. They're nauseous for all 9 months
Yeah,
of their
no, some
pregnancy. And
people
I was
do.
nauseous for 17 weeks with both my girls, and that alone was
That's
more than
brutal.
enough time to be
Yeah.
nauseous.
But you
Yeah,
were very
I was
nauseous.
actually nauseous and actively puking, but
Yeah, because you were very
Yes,
like
I was very sick.
outwardly- yeah, like if I ever felt nausea, it was more surrounding like, oh,
I
that smells
couldn't-
kind of funny.
I
and
couldn't go in a
upset
car
my tummy.
without puking in a parking lot somewhere.
Terrible.
Oh, it's
But-
awful.
Yeah, but it's okay. I made it. It was fine.
Well, we want to thank you so much for coming on. Did you have anything else that we missed that you want to touch on with midwifery care or anything?
No, I think we pretty much covered it. Thanks so much for having me.
Amazing.
Thank
Yeah.
you for coming on. This has been amazing, and I hope that it provides some people who are wondering about midwifery care some great insight.
Yeah, and we wish you the best luck with the rest of your pregnancy,
Yes.
and we hope to have you back again soon.
Thanks. Sounds great.
Okay,
See you later.
Bye.
Take care.